Hey guys, Miss Minoff here. I wanted to shoot this video to congratulate you on watching the CVC demonstration. I know it is a lengthy video, but I think it will really help prepare you for your checkoff experience. And more so, if you haven't finished, I encourage you to go back, pause, pull out your packet. It has step-by-step instructions. I try to follow those in my demonstration. I encourage you to take notes and practice well, because the way that you practice is the way you will do in your checkoff. And if you do high quality practice, you will do awesome in your checkoff, and it shows. I encourage you to keep going, don't give up. Please reach out to us if you have any questions. And this video is what I would give you. Would you be coming into class face-to-face? And I'd be giving you that verbal feedback as an instructor. So I wanted to shoot the video and let you know what are the things that I normally see students struggle with when they come in and practice face-to-face. One of the things that I wanted to share with you is in the video, you're gonna see that I asked somebody to put in the biopatch into my sterile field. Now, honestly, you guys, I shot that video so many times and I was so tired. By the time I finished, I was like, I want to be done with it. And the biopatch and some of the equipment was not cooperating that day. It just was not. So I didn't want to do the whole thing all over again. And so I asked somebody to open it. But now looking back, once you open up the biopatch and you have your sterile gloves on, you can actually have it open, and then you can lay it on your bedside table, and then you can, with your sterile gloves, you can go over and pick it up and put it in your sterile field, or you can just have it available, and then when you're ready to use it, you can go ahead and grab it from the packet. It's up to you. So let me go ahead and show you what I mean. So this is a sterile field. Part of being successful with the sterile field procedure is setting up your sterile field correctly, given the space, the limited space that you're going to have on the bedside table. What I mean by here is the biopatch is in my sterile field. I've already opened it and I'm laying it down. I'll kind of go over the way that I set this up, because this is what I give students that come in to practice face-to-face. I give them these instructions, I give them this feedback. So this biopatch, you can have it up here. You do have enough space at the bedside tables that we provide you at school. You can lay it up here. Once you have your gloves on, you can walk along the edge and then pick it up here. You don't want to reach over your sterile field, because this is where you're going to be standing. You see my foot right there? So you can leave it there. At the same time, we're also going to be providing you with a suture removal kit. Here in this, picture that I'm showing you here, the suture removal kit, the scissors and the forceps are already on my sterile field, but you can also have it open and kind of just, open the package, lay it, put it on top of your sterile field. Well, you're gonna open it first, put it on top, and then set up your sterile field underneath closest to you. And again, you don't want to reach over. You would just kind of, without turning your back to your sterile field, you would walk around and you would pick up those supplies. So some people feel comfortable just having it open with their sterile gloves, going around, picking it up, and then using it when you need to. Or some people want to have their sterile gloves on and then go around, pick it up, and put it into their sterile field. And then I'll tell you why it's important a little bit later on, why it's important for you to set it up this way. For checkoffs, at least for me, if you're checking off with me and I'm grading you, it's okay to make mistakes. People make mistakes all the time. We're human. We're not perfect, right? More importantly, what I'm looking for is your critical thinking in how you solve the problem before you. Okay, so you made a mistake. How are you going to fix it? Okay, no need to, get upset with yourself. No need to crumble. No need to shut off. So I want to make sure that you are problem solving, critical thinking. So take a deep breath, and I want to see what you do. Another thing that I want to talk to you about is sterility. We're going to be posting paper on how we're going to grade you for your checkoffs. There are some things that are automatic failures, and there's other things that are half points, right? Be familiar with those so they can prepare you for your checkoff experience. It's going to be for blood or IV push or chest tubes, they're going to have that criteria so that you know what are big things that we're looking for that we want you to not miss and help you to practice before you come to checkoffs. One of them being sterility. So if you're uncomfortable with this skill because it's a sterile procedure and you're having to put on your gloves and you're having to set up a sterile field, a lot of times a lot of students are nervous about that. You don't have to be. Again, this is why I'm shooting this video, to kind of help you with the setup, because the way that you set it up really sets you up to do well on the checkoff. The other thing is, if you mess up and you don't notice that you messed up, that's another reason that you might fail. I give you one pass to break sterility, but if you keep doing it, and then more importantly, if you're not realizing that you're breaking sterile technique, you're gonna have to redo. Take your practice seriously. Touching the hub with clean gloves. These are the mannequins that you're going to be taking off the CVC line or doing the dressing change on. When you take off this old dressing, you're going to be using clean gloves. What I want you guys to make sure is that in the video I say you're taking off the dressing from the edges, and you, as soon as you kind of come to this area close to the insertion site of the CVC line and right here, this hub, you want to make sure that you're not touching it, as you're trying to minimize the amount of time that you're touching it. Because remember, you have clean gloves, you're not sterile yet. And if an infection comes into these central lines, it goes straight into the heart, gets straight into the bloodstream, and that heart pumps blood everywhere, right? So what is an infection? Patient gets septic, and we don't want that. The patient comes into the hospital to get better. And most of the time, these patients that have central lines, they have to have a really good reason to have them. And most of the time, it's because they're very critically ill. So they can't have septicemia. It's just not good for the patient. You can kill a patient that way. Take this seriously. Try not to touch the hub when you're taking off the old dressing with clean gloves. Try to stabilize it as furthest as possible from the insertion site. 4x4 dressing. Let me see. All right, so I have a 4x4 gauze here. Once you take off the old dressing here, you're going to take off with clean gloves the old dressing, right? You're going to have open and grab a sterile 4x4 gauze to put on top of this site, because it's not going to have this tegaderm on top. So you're going to have a sterile 4x4 gauze. I need you, with your clean gloves, grab it from the edge, one of these edges. Don't grab it from the middle. You're going to grab it from the edge, and you're going to place it on top of your central line. Once you've set up your sterile field, put on your gloves, your sterile gloves and everything, you're going to grab it from the middle. So this is going to be on top of this, and you're going to pick it up from the middle, because remember, the inch or the 1/4 inch of this gauze is considered non-sterile. That's why you're picking it up from the edge with clean gloves. But once you have your sterile gloves, you want to pick it up from the middle, because it's sterile to sterile. So I wanted to clarify that. The other thing that I want to talk to you about is that in checkoffs, we're going to be providing you with a biohazard bag. We're going to be providing you with a suture removal kit. We're going to be providing you with the chest and hand sanitizer. Okay? So our biohazard bags are going to look like this. Sometimes when you guys are cleaning, I've seen this quite often, you guys are cleaning the hub, and I want you guys to clean around really good. Get some good friction right there on the insertion site, because that's what really matters. And then you're going to clean this entire area that's underneath the tegaderm, right? So you got your alcohol swabs, you're cleaning 3 times. You got your iodine swabs, you're cleaning 3 times. What I see some of you guys do is you guys come here and you're cleaning, and then you're out here, but then you come back right here. Or sometimes you're way out here and you come back right here. If you're far out on this side and you're cleaning on this side, but then you come back right here, that's a no-no. You want to be, you see that distance from here to here? You want that distance from there to here. Okay, so it's okay to get the person's neck or come all the way down. Get as far away from that central line, from that insertion site as possible. Once you're done with the actual swab that you're using, some of you guys like to play basketball, and you guys are dunkers, because you guys stick your sterile hand in there with the swab, and you actually reach into the bag. you're contaminating, right? You have sterile gloves on, you're gonna go back and you're gonna clean it, and then you're gonna also put a biopatch after that. Just drop it. Stay above your waist, your biohazard bag, and drop it. Because we're gonna be practicing at home and you're not gonna have these chests available, I'm gonna show you something that I came up with that you can use at home. So I have a picture here. And what this is I got a cereal box and I got a piece of paper and I drew my little hub right there. You can hardly see it, but it's there. Then I got some wax paper that it really doesn't stick to. I got my bio patch right there. And then I stuck my Tegaderm on top of the wax paper. And then I made a hole and I stuck a straw through there, resemble the CVC line. This is real life. This is what you're actually playing with, but I wanted something that you could actually put the cap on, right? And you can actually push fluid, but you're gonna get the cardboard wet. I got a paper clip as my clamps right there. That's how you can make your chest at home and you can practice. So I want you to practice talking to your patient, positioning your patient, taking the pillow out. Those are one of the big half or automatic failures if you don't do that. For checkoffs, you guys, you're gonna be doing 2 of the 3 skills. So for sure, you're gonna be doing the cap changing on 1. You're gonna have 3 lines when you come in for checkoffs. You're gonna have 3 of them, but you're only gonna do the cap change on 1. Once you come in, you're gonna introduce yourself to your patient. You're gonna assess for allergies, you're gonna verify the patient's, you're gonna do all that good stuff. You need to make sure that you remove the pill, you position your patient, you explain to them, today I'm going to be doing a cap change and a dressing change, or I'm going to be doing a cap change and a removal. Now, I know that you wouldn't do a cap change on a removal. If you're removing it, you're not going to be doing a cap change. But for purposes of checkoff, you're going to do 2 of those 3 skills. So for sure, you're going to do the cap change and either the dressing change or the removal. Once you explain to your patient and you position your patient for the cap change, you don't have to leave and then come back and do the whole thing. I want you to position your patient and gain permission from your patient as if you were gonna do both skills that first time. Then the other thing is you don't have a suture removal kit, okay? So get a towel, get some tweezers, get some scissors, put it in a towel so at least you can practice opening it, go through the motion of actually opening up the supplies and putting it there on your sterile field, reaching into it, and then putting it into your sterile field if you choose to do that. The other thing is you're not going to have a biohazard bag at home. Get yourself a grocery bag. Verbalize in your video that that's going to be your biohazard bag. So let me go over the way that you're going to set up your sterile field. Now, this is not the end-all be-all. This is just an example of what I've learned over the course of a few semesters of how the students that set themselves up well for checkoffs, they do a good job in setting up their sterile field and maximally using the space that they have available and on their bedside table. So the way that you're going to position yourself, the patient is right here, the patient's head is over here, and then the patient's body is this way. You can position yourself however you need to, but this side is closest to the patient. The way that it goes is you open up your packet. On the packet, one of the first things is your mask, the gloves, and then your actual sterile field, this drape right here. So you pull all those items out. You're going to lay out your sterile field. Remember, shiny side down, and don't lean over it. So once you lay that down, then you lay it closest to your patient, closest to you. Then you're going to grab your gloves, you're going to grab your sterile gloves, and then you're going to place them off to the side, so furthest from the patient. And you're going to place them right here. At this point, you're either going to open up your bio patch or you're going to open up your suture removal kit. And you're going to lay it on top of this section right here. Now remember, don't lean over it to open it, but you're going to have it open already. Then you're going to go ahead and open up you're going to come on this side, you're going to stand not turning your back on your sterile field, because you already have this drape open. And you're going to put on your gloves, and then you're going to come back and you're going to have the packet open already. And then you're going to reach into your sterile kit packet, and you're going to place the items in such a way in the order that you're going to use them for your patient. So you're going to place the alcohol first, then you're going to place the iodine, then the measuring tape. That setup is the same for whether you're doing the dressing change or the CVC removal. It's the same. Once you've gone ahead and set that up, then depending on if you're doing the dressing change, you're going to use the biopatch, and then you're going to put your Tegaderm on, and you're going to use the tape to seal the lumens of the CVC line. If you're going to do the removal, remember you already have your gloves on, so you can walk around and then grab. You have set up right here. You've already opened up your suture removal kit, so it's already open. You have your sterile gloves on, right? You're going to reach in with your sterile gloves. You're going to walk around and place it on your sterile field, the scissors and the forceps. Right here, you're going to use whatever you have provided in your kit, whether it's a 2x2 or a 4x4. You're going to use one of those gauzes to hold pressure over the site. And then after holding pressure, then you're going to go and use the other gauze, and you're going to remove it. And that's going to be the gauze that you leave after you remove the CVC. And then you're going to place a Tegaderm above that. And then you're going to do your education with your patient. I wanted to share this video to guide you on how to set it up at home using the minimal space that you've got, because when you come in, you're going to be using a bedside table. You're not going to be using a full-on table. I encourage you to keep notes of what you receive in your packet, just in case if you think that the company that you received your kit from doesn't have all the things that you need. Make sure that you keep track of that and you communicate with the company that you received the kit from. Thank you so much for watching this video, and I wish you much success. Please don't hesitate to reach out to me and let me know how I can help you. You take care and have yourself a wonderful day.